So just a couple of housekeeping things. Everyone will be muted as we go through our presentation, but feel free to chat us any questions or thoughts you have along the way, so we don't miss them, as we'll have a question and answer session at the end of the presentation. Next slide, please. So we are so excited to be sharing this Genetics Policy Hub webinar on the topic of newborn screening with you all today in celebration of Newborn Screening Awareness Month, which takes place annually every September to celebrate and raise awareness for newborn screening across the United States. So my name is Molly Caisse, and I am the NCC Project Manager, and we are thrilled to be co-presenting this webinar with Amy Gaviglio, who will be giving an overview of newborn screening policy, and we'll discuss some emerging trends on this topic. So I'll just give a quick overview of our learning objectives and an outline of the webinar, and then let Amy introduce herself and start off the webinar. Next slide, please. So the learning objectives for today's Genetics Policy Hub webinar are to explain the current ways in which newborn screening policy is set across the United States, describe how you can find information about newborn screening policy in the Genetics Policy Hub, and identify new and emerging policy trends in newborn screening. Thank you. So to achieve those learning objectives, our webinar will start with an overview of newborn screening policy. We'll discuss newborn screening policy information in the Genetics Policy Hub. We'll talk more about emerging policy trends. And then at the end, we'll have a question and answer session. But again, please feel free to chat us any questions or thoughts you have along the way so we don't miss them. So with that, I will turn it over to Amy to introduce herself and provide an overview of newborn screening policy.
Excellent. So thank you so much to both Molly and Megan for the invite to talk about newborn screening policy, especially during Newborn Screening Awareness Month, and doubly especially on the 60th anniversary of newborn screening. So by way of quick introduction, I am a genetic counselor by training. I worked in the Minnesota newborn screening program for 12 years before founding Kinetics Consulting back in 2019. And this company assists organizations in their newborn screening, rare disease, and public health genetics initiatives. Really, the work spans anywhere from advocacy and policy to implementation, informatics, and strategy. So very happy to be speaking with you today. Next slide. So before we really get into the topic of newborn screening policy, I want to take a quick step back and chat a little bit about what it actually means when we use the term policy. Because like a lot of things, it likely means very different things to different people and certainly within different contexts. So when we talk about policy, we often separate it into what we call big P policy and little p policy. So big P policy is likely what many of us are thinking about or referring to on this call. So this is policy that is set through things like legislation, litigation, or regulations. And this type of policy can be set at a number of different levels: the federal level, the state level, or the local level. When we talk about little p policy, we are referring to things like standard protocols, procedure manuals, organizational and administrative rules, or kind of overarching best practices or operational guidelines. And as we talk about newborn screening, both big P and little p policies are certainly vital in kind of structuring and managing the entirety of the screening system. Next slide, please. So much of newborn screening policy also falls under the fairly wide umbrella of public health policy. And so public health policy refers to the decisions, actions, and strategies taken by governments or health organizations to achieve specifically defined health goals within a society or jurisdiction. Public health policy in particular is generally designed to promote and protect the health of communities. And similar, I think, to the distinction of kind of big P and little p policy, public health policies can range anywhere from formal legislation to things like community outreach interventions. And public health policies really create action from research in an attempt to find widespread solutions to identified needs and problems. Next slide. So this slide illustrates what the research kind of to action process looks like as it pertains to policy. So this particular process comes from the CDC, but I think is quite representative of the general process used by most policy setting and policy influencing organizations. So while this policy process kind of is illustrated as a somewhat kind of clean, delineated process, it's really important to note that these steps kind of actually often overlap or may occur in a different order depending on the topic and context. But in general, the flow of policy setting usually starts with step one, which is shown in red, which is the identification of a problem or an issue that needs to be addressed. So the identification of the issue can come from things like listening sessions or focus groups, general observations, or through systematic data collection. And then following the identification of the problem or issue comes policy analysis. This is where different policy options are considered and evaluated for potential effectiveness, efficiency, and feasibility. This is also where potential costs and benefits are analyzed and potential other impacts of the policy are examined. After this comes the grouping listed in purple, which is strategy and policy development. This really perhaps is one of the toughest part of policy setting, as this part focuses on actually drafting the policy, getting feedback, engaging interested or affected partners, and really assessing the current context in which the policy will be enacted. Which then, of course, brings us to the fourth domain, which is policy enactment. This is the process of refining the policy and moving it through the relevant procedures to get the law passed or enacted. And then finally, in orange comes policy implementation. And I really can't stress this one enough, not just in general, but particularly in newborn screening. I think policy enactment is often seen as the last step, with the rollout and implementation of the policy kind of being overlooked in many cases. But a policy truly does nothing if people can't access the changes. And so this is the piece that really truly translates policy into practice, and where things like capacity building and sustainability are the focus. Really quickly, you'll notice in the middle of the graphic, we talk about partner engagement and evaluation, and these are really overarching components that need to span all of the other steps in the policymaking process. Next slide. So the last concept that I want to highlight is the idea of this health in all policies approach. And I mention this because when we think about newborn screening policy, we can often become very focused on those policies that clearly state or surround newborn screening programs and forget that there are many, many other policies that may actually impact the newborn screening system. So the health in all policies framework is one that really systematically takes into account the health impacts of decisions, seeks synergies across policies, and really tries to avoid harmful health impacts in order to improve population and health equity. Basically, it acknowledges that there are many, many complex factors that influence health and equity. So I really encourage us, as we think about newborn screening policy today and in the future, to try to take this approach in considering and examining policies. And we'll touch on a number of policies that we may not think are directly related to newborn screening, but certainly have an impact on the system. Next slide. So why is policy so important in newborn screening? The importance of policy in this program, I think, can often be summed up in 2 points. One is that newborn screening programs are public health programs whose goal is to provide universal and ideally equitable access to early diagnosis and treatment. The second is that newborn screening programs operate under quasi-mandates, meaning that the default is for newborn screening to occur. And I'll touch on this point in more detail on some of the next slides. I think really the mandated nature of newborn screening plays really heavily into policy needs now, and certainly policy trends for the future. So there are a number of areas across the newborn screening system where policies are helpful. They can provide things like increased funding to programs to expand, to screen for more diseases, or to improve their screening and follow up for existing diseases that they are already screening for. They can be used to add or even remove diseases from newborn screening panels. They can help address issues of access, I think primarily kind of before and after newborn screening. They can address things like data and dried blood spot storage and use. They can help clearly define the scope of the newborn screening program and solidify any operations that need to occur for a program to be successful. And of course, many, many other policies are important in newborn screening. Next slide. So on the last slide, I mentioned this idea that newborn screening programs are public health programs that by and large operate as a mandated opt-out program. So again, this means that the default is for newborn screening to occur, but nearly all programs in the US have opt-out or refusal provisions that allow for families to refuse newborn screening for a variety of reasons, kind of as illustrated in the table here. And in order for newborn screening programs to operate in this way, we rely on two primary legal and constitutional foundations. So the first is the 10th Amendment, which indicates that states have the power to regulate the receipt of medical care to protect public health. And the second is a pretty well-established common law doctrine known as parens patriae. So parens patriae permits the state to step in and make decisions for the health and well-being of citizens who cannot speak on their own behalf. So in this case, we're referring to newborns. Next slide, please. So while those two components really remain the legal and constitutional foundations of newborn screening, neither of them, of course, are absolutes. And both, I think, are very much evolving in the context of changes to medicine and scientific technologies. And there are very real current and ongoing challenges to these in newborn screening, as many have argued that mandates for medical procedures really must be weighed against the individual's constitutionally protected interests in personal autonomy and bodily integrity. So in particular, challenges to the newborn screening system have kind of leaned on two primary amendments, the 4th and 14th Amendment. So the 14th Amendment has been evoked really most recently regarding the concept and the protections of parents' fundamental rights to make decisions about their child's welfare, inclusive of medical treatment. The 4th Amendment has been considered more than the 14th in the context of newborn screening, particularly around the concept of illegal search and seizure, as this amendment applies to government action that potentially intrudes upon an individual's reasonable expectation of privacy. So while the legal basis of newborn screening is not the focus of this webinar, and it could be a whole day workshop, it is important to understand this, as I think this very much plays into some of the trends that we're going to talk about later on in newborn screening related policy. Next slide. So how does this all come together, and how is newborn screening related policy actually set? In most cases, because newborn screening programs are administered and governed at the state level, policies impacting the program and system are usually set at this level at the state. But again, this can be done through things like formal legislation, through decisions and recommendations made by the Newborn Screening Advisory Committee. It could be codified through rules, regulations, or administrative codes, or maybe simply represented by internal policies and procedures adopted by the screening program. But none of this state kind of focus does not mean that federal policies don't impact newborn screening. They most certainly do. And again, we'll cover some of the related federal policies later on in this webinar. But now that hopefully we have a good foundation for public health policy in general and newborn screening policy, I'm going to turn it back over to Molly to talk about the Genetics Policy Hub and kind of how you can track and stay up to date on newborn screening policies.
Thank you, Amy, for a really great overview of newborn screening policy. So yeah, as we think about what policy is and how it relates to the public health system and newborn screening, we wanted to take a step back and give a little more information and an overview about the National Coordinating Center and our Genetics Policy Hub and the work we do around providing information about genetics policy and policy related to newborn screening. So for those who might not be familiar with NCC, we are the National Coordinating Center for the Regional Genetics Networks, and we are a program that is federally funded by the Health Resources and Services Administration, HRSA. So NCC, along with the 7 regional genetics networks, as well as a National Genetics Education and Family Support Center, draw on this map on this slide, all work together to achieve the mission of improving access to genetic services for underserved populations. Next slide, please. So NCC works to achieve our mission in a variety of ways. So some of those I've highlighted on this slide. So this can range from genetics and genomics education activities to improving access to services via telemedicine, we call it telegenetics. Family engagement partnership is also a really integral part of our system in engaging those who have genetics conditions or are at risk for genetic conditions, really understand what their needs are. And then finally, NCC also has a focus on policy, which is where our genetics policy work comes into play. Next slide, please. So this work really began for us a number of years ago with the passage of the Affordable Care Act. So once the Affordable Care Act was passed into law, HRSA, our funders, came to NCC and the regional system to begin to develop specific resources around policy to help support the delivery of genetic services like newborn screening, follow-up treatment, genetic counseling, and so forth. So overall, what our system really focuses on is getting access to these services. And we're really looking at that delivery between patient and provider. So in 2015, NCC held a meeting with a group of partners to identify what the policy issues were and what resources are needed to better understand the policy landscape related to the delivery of genetic services. So I'll note, because NCC is federally funded, we're not positioned to advocate for any certain policies, and we don't have a stance or lean in one direction or another for any certain policy. So instead, NCC is really looking at this work through the lens of what policy resources are needed for providers, for public health professionals, for families, to understand what's happening in genetics and how that affects the delivery of care. So in 2017, HRSA specified 2 objectives for NCC to accomplish related to our policy work. And those are to look at monitoring, analyzing, and tracking of national policy issues. And we're also tasked with disseminating information on practices, policies, and resources related to the genetic service system. Next slide, please. So we've been doing this work for a number of years, and we've developed multiple resources over that time. And NCC has recently compiled these resources into a new policy website that we're really fortunate to launch last year. So it's called the Genetics Policy Hub website. So this is a fully searchable website where you can search for topics and information related to genetics and genetics policy, like newborn screening, and find everything we have related to that topic. So there's information not just about newborn screening, but really a wide scope of genetic policy areas. There are a lot of really great tools and resources on the website, which I'll go into more detail on in later slides. So we have policy area pages that summarize different topics and policy concerns that impact the delivery of genetic services. You can find all the proposed genetics legislation and regulation we track. And the website has a Medicaid database, which is updated annually. And we look at all the publicly available written Medicaid policies related to genetic service delivery. And there are also general resources like events, things like information about this genetics policy webinar series, and other webinars and educational events we hold related to policy. Next slide, please. So as I mentioned on previous slides, this is an example of one of the tools on the Genetics Policy Hub website. So this is one of the policy area pages for newborn screening. So each page for each policy area is structured similarly, and it includes short briefs that describe why a certain topic is a policy concern for the genetics community. It lists the current proposed legislation and regulation related to the topic. And we share policy statements from organizations that present that organization's stance on the topic. So you can really go in and learn about those areas of newborn screening policy or other areas of genetics policy. And there are some really great resources in each policy area from genetics organizations. For the newborn screening policy area, there's resources from the National Institutes of Health, Health Resources and Services Administration, and Baby's First Tests. We're always really so appreciative of the ways we can connect with other organizations and the work they do to really help provide education and disseminate information about genetics policy and topics like newborn screening. Next slide, please. So in speaking more on connecting with other organizations and the work they do, also on each policy area page on the Genetics Policy Hub website is different policy statements. So NCC is tasked with disseminating these statements from organizations that work within the genetics community, like national genetics organizations, advocacy organizations, that have published positions on certain topics like newborn screening. And so we've collated those policy statements together on each policy area page. So for newborn screening, there are 36 policy statements on the Genetics Policy Hub. So on this slide is 3 of the more recent examples from the past few years. So the first is from the National Society of Genetic Counselors. And this policy statement states that the organization supports newborn screening for the recommended uniform screening panel, as well as state mandated newborn screening systems. And the second statement here in the middle from the Association of Public Health Laboratories states their belief in the importance of short-term follow-up programs and continuity of operations plans in cases of emergency. And the third statement from the Association of State and Territorial Health Officials is in regards to sample storage and retention. So overall, we can see these policy statements are focusing on policy related to which disorders organizations think should be included for newborn screening, subsequent follow-up for newborn screening, emergency planning, and the storage of newborn screening and samples. So you can see these touch on some of what Amy mentioned previously, those parts of the policy that focus on protocol and organization, and administrative rules, as well as legislation at different levels. And also, as Amy discussed, you can see there are many policies that impact the newborn screening system. And these policy statements on this slide reflect just a few of those. Next slide, please. So this is a look at some current legislation relating to newborn screening, either enacted or proposed during this year's legislative session. So this is based on another tool within the Genetics Policy Hub that we have, which is our tracking of proposed and enacted legislation and regulation at the state and the federal level. So we use a system called Physical Note, and every day we look to see what policies and bills are being introduced based on specific search terms related to genetics. So you can see there have been 7 enacted bills related to newborn screening across 7 states as the beginning of this year. And there are currently 15 proposed bills related to newborn screening also across 7 states. So this is really an example of some of the information we display in the Genetics Policy Hub related to our tracking of proposed and enacted legislation regulation. Really to provide information about legislation by certain genetic topic areas, at the state or in other cases, the federal level. So in the next few slides, I'll discuss a few of these enacted and a few of these proposed bills. And then Amy will go into more detail to really discuss the trends found in current newborn screening legislation, and also discuss how this impacts newborn screening policy moving forward. The next slide, please. So on this slide is a bill enacted in Arkansas on April 5th. It's called the Universal Newborn Screening Act, which created a universal newborn screening program to require the State Department of Health to screen for conditions listed in the recommended uniform screening panel to provide appropriate newborn screening guidelines to protect the health and welfare of newborns. So this is an example of a tweet or a post that we include on the Genetics Policy Hub Twitter. So we tweet about any proposed or enacted bills, and each tweet includes a graphic that says the status of the bill, the state, the title of the bill, and then gives a brief description of the bill. Next slide, please. So this is an example of another graphic you would find on a tweet or a post on the Genetics Policy Hub Twitter. So this is an example of another bill enacted this year, also in April in Montana, which revised laws related to the collection of genetic material for newborn screening. So it provides that genetic material obtained for newborn screening may not be used for any other purpose than newborn screening without parental consent. And it includes provisions for the destruction of genetic materials by laboratories under certain circumstances. So the previous bill enacted in Arkansas and this bill enacted in Montana really showed two examples of types of newborn screening policy at the state level. So again, this reflects back to Amy's discussion on the different types of ways in which policies impacting newborn screening can be set at the state level, and reasons why policy might be needed at the newborn screening level for areas like adding new disorders for screening and data and addressing the sample and storage use related to newborn screening. Next slide, please. So now swapping over from enacted legislation to some currently proposed legislation. This slide lists 5 examples of proposed legislation related to newborn screening at the state level. So there are, as I mentioned before, 15 proposed bills found in the Genetics Policy Hub that we're tracking. So this is just a sample of some of the bills that are currently in consideration, which relate to things like adding certain conditions to the state's newborn screening panels. It's happening across these 3 states, so in New York and Massachusetts and South Carolina. There's also proposed legislation related to requirements for the notification of out-of-range newborn screening results in South Carolina. So as I mentioned, these are not all of the proposed bills related to newborn screening we're currently tracking. So you can certainly go onto the Genetics Policy Hub website and view the other bills that are being proposed related to newborn screening if you're interested. So as you can see, newborn screening is really a very active area of genetics policy. And it really sees a lot of movement, especially at the state level, which you will see more about in the slides related to policy trends. Next slide, please. So in the Genetics Policy Hub, we've also created a policy brief to give you an overview of newborn screening policy. So this is really a snapshot of newborn screening policy that lists information about enacted and proposed legislation and regulation, Medicaid policies, and policy statements. So again, I would really encourage anyone, if you're interested, to go into the Genetics Policy Hub website and download this overview if you want to learn more, and to explore the other tools and resources that were shared today, like the policy area pages and all that legislation that's being tracked. I've also briefly mentioned our Medicaid database in past slides. So this is a tool that uses publicly available coverage policies to provide information about what genetic services are covered under Medicaid. So our database has more information about newborn screening as it relates to Medicaid, as well as information about Medicaid coverage a variety of other types of genetic services. So if you're interested, that's a great resource to explore, and it's currently being updated. And we hope in the next couple of weeks, we'll have the data up for 2023. So with that, I will turn it back to Amy to talk more about emerging trends in newborn screening policy.
Excellent. Thank you so much, Molly. And super big fan of the Genetics Policy Hub. It is so helpful and does so much of the work for you. So cannot recommend enough following them on your favorite social media platform. Next slide. So as I thought about policy trends in newborn screening, I thought it would be helpful to try to outline the kind of range of policy focal areas that can impact the newborn screening system. So for the purpose of the rest of today, I'll focus primarily on four main areas. We'll start with the obvious. So those are the policies that are very clearly directed to the newborn screening program or focus on aligning state newborn screening programs with the federal recommended uniform screening panel, or RUSP. This plays into some of the examples that Molly just showed. From there, we'll touch on policies related to genetic privacy, data, and use. Then we'll cover policies that maybe aren't as directly related to newborn screening, but address the rare diseases more globally that may be identified through newborn screening. So we'll look at things in terms of access and coverage of diagnostic testing and treatments. And then finally, we'll talk a bit about policies related to therapy and drug development, because these are really important in essentially kind of feeding into the newborn screening system. So the idea behind that is that diseases that have effective pre-symptomatic treatments available are more likely to meet criteria for inclusion on newborn screening panels. So it's important for us to kind of think and watch this upstream policy area as well. Next slide, please. Thank you. So one policy trend that we are seeing that I want to mention first is the creation of rare disease advisory councils, or RDACs, across the nation. This is an initiative coming out of NORD. And I mention this because while these are distinct distinct entities from newborn screening advisory committees, they are very much potentially related. And so newborn screening advisory committees may or may not be created via legislation or maybe through rules and regulations. And their focal point is really on the newborn screening program, primarily looking at workflows, algorithms, and which diseases will be screened for by each state. Whereas rare disease advisory councils have much more global breadth around kind of the rare disease community as a whole. So both New Steps, what that's shown on the left, and NORD are certainly great resources to understand kind of the nuances, roles, and scope of these two bodies. And certainly for those states that have both a newborn screening advisory committee and an RDAC, I highly encourage collaboration and integration when appropriate, because there is clearly overlap between overarching rare disease work, which again is the focus of the RDAC, and newborn screening, which is obviously the focus of the newborn screening advisory committees. Both of these groups can serve as really nice resources for patient advocates who are looking to get more involved in policy development around newborn screening. Next slide, please. So perhaps one of the largest trends we are seeing right now, and I alluded to this a bit earlier on, is the continued discussion surrounding residual dried blood spot and newborn screening data storage and use. So as a very quick brief background for those of you who aren't quite familiar with this component of newborn screening, after newborn screening is completed, there is often a small amount of blood left over on the filter paper, and newborn screening programs store this for varying amounts of time. Storing these blood spots serve a number of purposes, most of them related to ongoing program operations. So things like making sure that our testing equipment is working properly, or having the ability to retest a specimen without having to kind of bring the family back in for another blood draw. These specimens can also be used for developing newborn screening tests. So obviously we started with one newborn screening test 60 years ago. Now we're screening for many, many diseases, and that came through development using residual dried blood spots. These spots can also potentially be used, typically in a de-identified manner, for conducting public health studies and research. And this component of newborn screening has really remained quite controversial, largely owing, again, to this mandated nature of newborn screening. And you can see on the right, I pulled a sampling of headlines, and these are actually headlines from the past year or two, highlighting this ongoing debate. And so in terms of policy in this area, I think we are seeing actions at really all levels, including refining statutory language at the state level that defines kind of how these samples can and cannot be used, all the way down to internal programmatic policies on storage and use practices. Next slide. So another policy trend acknowledges that the current federal process that we've talked about a bit, this recommended uniform screening panel process, which is used to add diseases at the federal level as recommendations to be screened for at the state level. This process is both lengthy and really just represents the first step to actually getting babies screened. And so an effort largely led by the Every Life Foundation, known as RUSP alignment legislation, is a big focus area. And this is very similar to the example that Molly showed with Arkansas in terms of kind of putting in place requirements for programs to start screening for diseases that have been approved for the inclusion on the RUSP within a defined time frame. RUSP alignment legislation, though, it really tries to go above and beyond just saying, hey, you have to do this and you have to do this within a certain time. They do seek to understand what the barriers are within newborn screening programs to timely implementation of screening, and can use this legislation to help kind of codify additional language that maybe can help address those barriers. So in addition to these kind of RUSP alignment legislative efforts, we also see direct legislative efforts to simply add a single disease to a single state's newborn screening panel. Usually these diseases are those that are either going through the RUSP process or are not going through the RUSP process. And so they're kind of going directly to the state and working on implementation in that way. So the picture on the left shows the signing of a law recently requiring the state of Illinois to screen for a disease known as metachromatic leukodystrophy. This is a disease not yet on the RUSP, but does have very promising treatment in the pipeline. So again, I want to point out with these legislative efforts, it's really critical for programs and advocacy groups to work together to ensure that any of these types of legislation where you're really trying to add diseases, you're trying to add processes, that the legislation is written in such a way to ensure appropriate resource allocation in order to set up the program for successful and sustainable screening practices. Next slide. So speaking of resource allocation, can't talk about newborn screening policy without talking about funding needs. So most newborn screening programs generate their revenues through the sale of the newborn screening kit or filter paper cards. And often the price of these cards is set via legislation, rules and regulations, or administrative code. So you can see on the map on the right, and this is from New Steps again, there's quite a wide variation in the fees for newborn screening, though I do want to asterisk that many times because it's a bit hard to do a true comparison by just looking at a map, because what the fee actually covers likely differs from state to state in terms of whether it's covering all of the testing, is it covering testing and follow-up, IT infrastructure, specialists. So it's really important that you kind of take the map for what it is, but you need to really dive in to better understand the breadth of what's being charged and what that's going to. But certainly as we think about adding new diseases, which is there is a huge push in newborn screening to do so, more funding will certainly be needed to ensure that the entirety of the newborn screening system actually has the capacity to successfully handle any expansion of screening. Next slide, please. So building on the funding piece, and I just alluded to this a bit, but it's important to note that newborn screening program funding really needs to cover more than just the equipment and reagents needed to do the testing. It needs to cover things like education and training of families and providers, follow-up services, making sure that those families who are screen positive are getting a diagnosis and treatment. It needs to cover things like facility infrastructure, IT, et cetera, et cetera. And I would say, in terms of policy programs, are also looking at ways to make sure that they have essentially a pool of funding to pull from to help them develop new tests and be able to implement more quickly. So one of the problems that we've often seen in implementation of new diseases within programs is that programs can't begin testing until they're able to raise their fee. And if this needs to go through the legislative process, and depending on the funding year, this can really stall implementation and disease additions significantly. So I'm going to highlight here, Texas actually dealt with this recently, and I think really came out with a great solution. They were able to create, through policy, what they call a newborn screening preservation fund, which essentially sets aside funds specifically for test additions and improvements so that as new technologies, new diseases come down the pipeline, they will be able to be more agile in their ability to add and kind of transition to these technologies. And I think this can really serve as a great model for other programs. Next slide, please. So another very hot topic right now, which is a bit similar to the discussion around dried blood spot and data storage and use, are issues around genetic privacy. Molly mentioned this as well, but specifically around data and specimen protections and who has access to them. So many states in the US, I think over 30, I believe, have some sort of genetic privacy legislation that governs both consent processes and disclosure restrictions for genetic and genomic information. While many of these are not specifically focused on newborn screening programs, they absolutely have potential impacts based on things like how genetic information is defined, and whether or not the newborn screening programs have been called out or exempted from the provisions. So in terms of kind of genetic privacy and use of data, use of specimens, we're also seeing a really much needed trend in restricting law enforcement use of residual dried blood spots and data. This is stemming from some recent articles, kind of the one on the right in the middle, that highlighted that newborn screening residual dried blood spots have been used previously by law enforcement in attempts to solve cold cases. And so this is something we're definitely seeing a lot more of. If you can go to the next slide. So this is a map that was put together by Natalie Ram for really a robust analysis she did on the topic of law enforcement use and DNA forensics with newborn screening specimens. And so as you can see, those in blue have laws that either restrict or seemingly permit the use of these specimens and information by law enforcement. Those in white did not really have explicit language, so kind of potential use is a bit inconclusive. So we saw a number of states in last year's session, and I think very likely we'll see more again in this year's session as well, are looking to amend language to try to address this issue, really in an effort to maintain kind of the integrity and functioning of the newborn screening program, while restricting and trying to preserve privacy. If this is a topic that is of interest to you, I highly recommend reading Natalie's analysis. It is quite long, but amazing. And I think I can figure out a way to share with you somehow in the chat box. I'll do that in a bit. Next slide, please. So during the COVID-19 pandemic, I think if you've heard of it, the expansion of telehealth access really greatly enhanced coverage in clinical services for rare disease families, which of course then trickles down to newborn screening. So not surprisingly, many rare disease and newborn screening families have to travel significant distances for their care, as they are often seeing specialists confined to more urban areas. And so telehealth and telegenetics in particular allows rare disease families to access this care more easily. But with time limitations on the policies that were enabled by the COVID-19 kind of emergency declaration. So things like flexibility in telehealth, regardless of geographic location. We're going to have to really be watching, I think, policies that are going to try to address either the transition back to how things used to be pre-pandemic, or an attempt to continue some of these flexibilities after the December 2024 expiration date. Definitely, I think something to watch. And as we screen for more diseases within newborn screening with longer monitoring periods, the need for telehealth, telegenetics is likely to increase. And again, the need for this, especially across state lines for those diseases that only have a few experts with experience. Next slide. So one of the final trends I want to point out is in regards to improving access to diagnosis and treatment, both post newborn screening, but also in the rare disease space in general. So we know that rare disease patients face both diagnostic and therapeutic odysseys. And so there's a lot of policy work being done to try to reduce the time to diagnosis and treatment. So this can mean policy at the federal level, like the HEART Act, which seeks to streamline the rare disease drug development process. Again, understanding that a lot of the drug development requirements were set up originally for common diseases, and in many cases, it's just it's either inappropriate or not feasible to comply with those requirements for rare disease. But it can also mean state legislation. So this is a bill that we did in Minnesota and we were able to pass last year, which does allow those with either a diagnosed or suspected rare disease to seek out-of-network care without financial penalty. So other policies in this area include coverage of things like rapid whole genome sequencing in the NICU, as well as specific coverage of certain treatments, which leads me to my next slide. Which discusses policy around coverage of medical foods and formulas or medical nutrition. So despite being the type of treatment that has been used for the very first disease we started screening for in the early 1960s, so PKU, coverage for medical foods and formulas remains an issue for many of our newborn screening families above and beyond PKU. So while it's important for us to look at policies covering new technologies like rapid whole genome sequencing and new treatments like gene and cellular therapies, we really can't forget about ongoing and existing access issues, even for those treatments that have been around for decades. So coverage of medical nutrition is something that is being worked on at both the federal and state level. I really like this graphic from the National PKU Alliance because I think it really nicely illustrates that even when states or programs think they have coverage, or in theory do have coverage, in some cases in policy, in practice, there can still be real barriers to implementation and access. And these barriers can be due to limitations in policy on things like the insurance types that are covered, the diagnoses covered, eligibility criteria like age and income, or even a true lack of awareness that the coverage even exists. Next slide. So before wrapping up, I would be remiss if I didn't mention perhaps the most important newborn screening related federal policy, which is the Newborn Screening Saves Lives Reauthorization Act. And this act was passed 15 years ago in 2008 and established a number of components like the committee that oversees the RUSP, as well as authorizing CDC and HRSA to provide technical assistance and services to state newborn screening programs. Unfortunately, this act expired back on September 30th, 2019, and has yet to be reauthorized, largely owing to considerations around things like consent, dried blood spot use, and genetic privacy. In the last go around, there was some success in moving something forward in this act, which is they were able to pass a directive to the National Academies of Science to develop policy recommendations for modernization of the newborn screening system. And I think it'll be really interesting to see what ends up being included in that report and how it shapes not only this act, but other related newborn screening policies moving forward. Next slide. This is my last slide. So I hope that after today, it's become fairly clear that one of the most interesting aspects, I think, of newborn screening is that it is a program or system that brings together policy, science, and medicine and people. And kind of my three key takeaways from today are that first, undoubtedly, this integration of multiple partners will continue to be a hallmark of newborn screening moving forward. We will, I think, continue to see a wide range of big P and little p policies affecting the newborn screening system, originating at all levels, federal, state, and local. And finally, it is really becoming increasingly important for an assessment of policies and above and beyond those that clearly focus on newborn screening programs, as the impacts of other policies will and have certainly touched on the entirety of the newborn screening system. So I think with that, I will end, and we have a few minutes for questions.
Yeah, thank you so much. Yeah, I think the overview of the newborn screening policy trends really shows, what an active space, newborn screening policy is currently. So yes, we can definitely open it up to some questions and any questions that we can answer. There was a question in the chat about where you can get a list of disorders that are screened in which state. So there are some really great resources online. So I did want to add a link to the chat for one of those resources. So this is a resource from the Health Resources and Services Administration that can provide that information. So it has a list of conditions that are screened in each state. It also has contact information for that state's newborn screening program.
I'm going to put a link to that review I mentioned as well in terms of law enforcement use. It's a heavy read, though. Make sure you have lots of time.
And if we don't have any other questions, or while people are thinking of their questions, on the next slide, we do have some additional contact information. So this slide has some ways to reach NCC and Genetics Policy Hub team, via email or social media. On that previous slide, Amy had provided her contact information as well. So we encourage you to reach out with any additional questions, or to visit the Genetics Policy Hub website, explore the resources discussed today, as well as what Amy has provided in the chat. Again, we thank you so much for attending our webinar.
Thank you.